Good evening, and thank you for taking the time to tune into another episode of Otto's Hours. For those of you who are unfamiliar, Otto's Hours is a show that gives me the opportunity to interact with some of Harrisburg's community leaders and discuss topics many of you, the viewers, discuss in your own settings. Before we get started, I would like to show you a video that shares information on minority health disparities set in the city of Baltimore, a city with similar disparities and statistics as our own.
The world has got to change. I live in a community that was so prosperous with doctors and lawyers and politicians. Now we have drug dealers and corner stores that they don't sell anything but the wrong things. You cannot deny the impact that it has on people's health. I have been in West Baltimore my entire life. As far as money, my mother didn't have any money. I don't want to say she was poor, I'll say low income. Poor we were though. In the 50s, we didn't have many choices as far as healthcare. The healthcare system then was limited. It was not good for us. And medicine costing so much that my family says sometimes, will I eat or will I pay for my medicine?
Which one do you, Mommy?
Oh, I just love my daughters when they come over and we get together and we cook and prepare meals together. It's healthy meals. When my oldest went to college, she came back with a different diet.
Now what happens is, if I do a meatloaf, it's turkey instead of ground beef. You know, I make spaghetti, I make chili, stuff like that. It's with turkey and chicken. We grew up, we ate pork. We ate bacon, we ate a fresh shoulder, we ate pork chops. I did not think it was not healthy eating. Right. Because this is what we were accustomed to. I was in denial. I didn't want to face the fact that I was becoming a diabetic.
The impact is the fact that my family ended up with heart disease, emphysema, diabetes, cancer. My mother's sister, her daughter died of diabetes. She was an amputee. My mother died of a massive heart attack. And
to address health disparities, we need to understand why they exist, that they're not due to one single factor. They're the result of policy decisions we make as a society. They're due to the environment, health education, insurance and access to care, access to healthy food, and stress. Those stresses are actually experienced disproportionately by people who are poor and people who have been historically disadvantaged in this society.
solutions to these problems cannot just be medical, it's systemic. And that means everybody has to get involved.
If we want a nation to be strong, the people in that nation have to be healthy. They have to be well. If there's anything that we can do to stamp out disparities, we need to do it by any means necessary.
Hi, Ms. Simmons.
Hi, Dr.
Here at East Baltimore Medical Center, most of the patients are underserved.
We need nice deep breaths getting up through your mouth.
Michelle is a terrific success story. There was actually a year where she had lost her job, and before she found a new one, she had no health insurance. And she still managed to buy her medicines out of pocket, paid out of pocket to come and have doctor visits. She was really invested in her own health. That's something that Dr. Cooper's research is looking at, why patients don't invest in their health like we wish they would.
The next thing on the agenda is the community update, so I'm going to turn.
Michelle joined our Community Advisory Board in 2011. We provide education to the community about health and about research. We offer training programs for community health workers. We can be sure that we are meeting the needs of people appropriately and that we're not leaving out certain groups of people that have traditionally not been included in conversations related to health and health care. Our strong relationship with the community is just essential. There's no way that we could do what we're doing without their input. And my work is just one of many initiatives here at Hopkins.
Good to see you too.
Ms. Simmons is a great example of what happens when we get it right as clinicians and as an institution.
I am a fighter. I am a believer. I stand for what's right. And what's right is people's health. And I will never give up as long as I have breath in my body.
One of the things that is so important is that people have what I call a liberated future. And it's hard to be liberated when you're not healthy. And when I say liberated, I mean freedom to be all that God meant for you to be. When we don't deal with disparities, then what we're doing is denying people an opportunity to give back to the world. And so we've got to fight it. We've got to fight it with everything we've got.
Wow, that was an amazing video. Welcome back, everyone. This evening's guests are three dynamic women who are household names, thanks to the work that they've put in the local, national, and yes, of course, even international levels. I'd like to introduce you to Dr. Roxane Hearn, a health and wellness psychologist, Dr. Karima Fitzgerald, who is an assistant professor of surgery, a trauma surgeon, and vice chair of diversity, equity, and inclusion, and of course, my very long-term friend, whom we created an actual international exchange program together with doctors in the Dominican Republic, and we're also helping them to rebuild and expand our health system in the Dominican Republic. And of course, last but not least, our good friend, Gillian Sumpter, who's the owner of KZM Enterprise Consulting and Health Educator. Ladies, thank you for joining me this evening, and I'm truly honored with your participation. You know, this video showed a lot of different components of health and wellness in underserved communities. Many of us know that the terms of health or wellness can be terms used broadly. Dr. Hearn, can you talk a bit about how your work touches on a person's overall well-being?
My work touches on a person's overall well-being in that oftentimes when I meet or a patient or individual client comes to me, it's either because a doctor, a family member, or even themselves, it's been brought to their attention that something's just not right. Maybe it's the diagnosis of diabetes, or maybe it's simply that I don't like how my pants are fitting. They're a little bit too tight. However, when I begin to work with them, you realize that a diagnosis of diabetes is just not taking the medication, but it may be linked to some of the stress. It then exposes possibly some of the barriers as to why and what led to the diagnosis of diabetes. And so as we begin to dig deeper and work to change their health behaviors so they have better health outcomes, we start to see the socioeconomic, the psychological, biological, cultural, all of these different factors that impact an individual that leads to these health outcomes. So that's how it affects the whole being.
Thank you, Dr. Fitzgerald. Many of the spaces that address health and wellness tend to have a mixed crowd based on medical assistants, students, and residents. However, the higher we look, the less diverse the pool of doctors becomes. Why do you think representation in the medical field is such a problem?
I think a lot of it has to do with the fact that we are not truly represented at those higher leadership positions. And so therefore the upcoming classes of residents and medical students don't have any role models. A lot of the rigors of medicine, regardless of the specialty, can be extremely detrimental to one's mental health. So I think it's really important that we're having this conversation. And without that long-term support, it's very difficult to survive in the vigorous field of medicine. So I think representation is extremely important, but there are a lot of spaces where we're not truly supported, which ultimately makes us not visible in those spaces because we don't stay in the field for very long. So I think having more mentorship as we're coming through and we're doing training, and then even early on in our careers, would be the best way to help encourage more young people to continue on their pursuits of medicine.
So do you believe, Dr. Fitzgerald, that what should the community be doing to help support more doctors of color? What could we do to support you as well as encourage other young people to get involved in the medical field?
I think just having the support and encouragement from an early age and just reminding kids that they can be anything that they put their mind to, and remembering that some of the factors that are typically a hindrance should not be considered as an obstacle to them proceeding in the field. I think as a community, we need to learn how to start trusting our healthcare professionals again and being able to appreciate the fact that we do exist in those spaces and allowing us to share in the experience of managing somebody's health. I think also from a community and leadership standpoint, we just need to make sure that we may seek out other people, not necessarily from within our own institutions, but other people in other places that may be represented in order to have that sense of camaraderie and belonging that would allow us to stay in those spaces for a longer period of time. I think making sure that there's longevity in what we do is going to be the biggest thing that will allow for students and residents to actually stick in the field. And then for those of us who've already gone through the training, making sure that we reach out to those other people in other spaces who've gone through it and may have even been in spaces that weren't comfortable and still managed to survive.
So we just need to recognize that your ice is just as cold as anybody else's, right?
Pretty much. That's
yes, it is.
Said.
As we all know, the global pandemic has been an area of concern for all residents, but especially those with autoimmune issues. Gillian, you work with a population that has already experienced, obviously, a global pandemic. Talk to us about the community you serve and the idea of an already existing pandemic for our population suffering with HIV/AIDS.
Right. So, everybody's talking about the global pandemic, but there is an epidemic that is still occurring in our community, especially in the Black community and the Latino community. Individuals are still suffering from complications from HIV, and we are also seeing a rise of new infections as well. And because of the pandemic, we've also seen an increase in new infections as well, because of all of the things that you all have talked about already, and accessibility to healthcare, and accessibility to mental health. And not having access also to substance abuse treatment has also contributed to new cases of HIV in our community. So again, just having a conversation, talking about HIV, like I said, it's an epidemic, a pandemic that is still occurring in our communities. And it's something that we absolutely need to still keep talking about, keep on the forefront, and ensure that we are keeping new initiatives and new programs available for prevention in the community.
And when you talk about programs and prevention, of course, there's always a discussion around resources and availability of resources. Are there enough resources out there that specifically target our community?
I would say that we are doing better than we have. I've been in the field for about 11 years, and we have more initiatives and we have more programming now than I have seen in the past, and we're doing very well. It's connecting the community to these resources. It's about bringing prevention to the forefront. It's about decreasing stigma and having these conversations so individuals know that living with HIV is just as common as living with diabetes. HIV is so stigmatized that individuals don't want to talk about it. They don't want to attend groups. They don't want to attend support groups and things of that nature because they don't feel like it's a normal diagnosis. Again, it is something that we're dealing with, and we want to decrease new infections, but also creating programming for individuals who are living with HIV and letting them know that their community does support them and we do stand behind them. Again, like I said, it's connecting individuals who are already living with HIV in the community to the current resources that we have. But I think that we're doing a good job as far as creating new initiatives in regard to like prevention and living with HIV.
I'm going to take a question from the audience. The audience says, do you acknowledge holistic healing? And this is for everyone. Do you acknowledge that holistic healing is effective? And do you believe that the field is a threat to traditional medicine? Starting with you, Dr. Hearn.
I'll go in reverse. The field can be a threat to holistic health when doctors choose not to share the information. Sometimes it's driven by, I want to say that, and this is possibly Dr. Fitzgerald, you will be able to speak to this, but we remember decades ago when doctors' pockets were padded with games, with tickets, with things like that, because they would write so many scripts for a particular diagnosis. We would like to think that those days are gone, but also I believe it's in some of the training of our medical professionals where they don't always, it's not in the curriculum, where they cover the different holistic approaches that have been tried and true to this point. One of them we look at, and oftentimes for me on my end, because I often will lean towards more holistic approaches first. I often tell them to check with their doctor, especially if they're taking certain medications, because the medications they take can cause other poor health outcomes. For example, I have rheumatoid arthritis. They said, take this pill, but guess what? One of the side effects is you may get glaucoma. Oh, and if you get glaucoma, though, however, now the medical marijuana is approved, marijuana will help cure it. Oh, but take the marijuana first. Not to bring up a hot topic, Otto.
Hey, I don't mind.
I mean, hey, that's
a whole nother. You know what? I think we could spend an entire Otto's hour discussing marijuana. I think I'm going to just do that as well. You're right.
But that's one of the pieces that now falls into holistic health because it is an herb. And so much like St. John's wort and ginseng root and different things, it has its place. But we also have to be mindful as practitioners of the research and of any possible interactions that may occur because of other medications that an individual may be taking. So that's why, in addition to supplements, things like meditation, exercise, eating healthy, you can count those as holistic health.
All right. Ms. Sumpter, I understand that you actually make homemade remedies. Is that true?
Yeah, so I was like, oh, when the question came up, I'm like, yes. Yes, I actually during COVID took a master herbalist class. And I started to create remedies that I've always given to my family and the community. I started doing it for my family and like my immediate family. And then I started seeing people saying, oh, I'm having this issue. And I was like, okay, so yes, I make homemade remedies and they work for individuals who have asthma, individuals who have respiratory issues, you name it. So yes, I do. That's what I do. And
I understand it. Yeah. I mean, when you think about it, like, to make aspirin, you take bark essentially, right? And then create
different things. Yeah, you can take it depends. And you again, like Dr. Rox said, you do have to consult with your medical provider to make sure. And I always tell people that I am not a doctor, not a healer or anything like that. These are just things that I've worked for me and my family. And if they assist in some of the symptoms. And I always tell people who shop with me, these are going to treat the root of your issue and not just the symptoms. When somebody has COVID, you're taking NyQuil or whatever, these things are going to actually help the root and kill the virus rather than just cure you from your symptoms. So, yeah.
Dr. Fitzgerald, do you think that holistic medicine is a threat to traditional medicine? Or do you think there's some sort of symbiotic relationship that can be derived from it?
So I think that it is symbiotic in the sense that there are certain things that do work for certain people that actually contribute to their overall well-being because it gives them a sort of peace of mind. But with all things, you should consult with your medical physician first and foremost, because there are several drugs and herbs and things like that that will have additional side effects, especially when mixed with modern medication. I think that overall, it contributes to patients' well-being when they feel like they're getting a benefit that's not a chemical that's man-made. But I think sometimes people fail to remember that some of these chemicals are packaged and man-made. So, I don't think it's a threat to modern medicine. I think that there are still several things that we'll have to continue to do that can't be fixed with a holistic approach. But I think if the combination is used, it would make it a much better and well-approached sort of situation if people just take into consideration that not everything that we buy over the counter is also good for us.
Excellent. Thank you. Dr. Hearn, studies show that there's an increase in poor health outcomes during this pandemic from both a physical and mental health perspective. Let's talk a bit about how our minds and bodies are connected and what that means when things like a pandemic takes place.
So when we talk about the mind-body connection, your thoughts, your feelings, your beliefs, your attitudes can positively or negatively affect your body, and vice versa. With your body, things that we eat, how we move our body, even things like our posture can negatively affect our minds. And so when the pandemic hit, I think most of us would agree there was a level of fear of the uncertainty. There was fear of if it was going to affect your family or friends. You then had grief because there's loss. So the feelings of grief. So I'm talking all negative feelings Negative feelings affecting the body. These all fall into the, creating a stress. So also the lack of access to typical resources that individuals would have, such as childcare. That's creating a greater stress. I don't know how many moms, I'm blessed that my daughter's 18, but many moms had to become kindergarten teachers, first grade teachers. That's an added level of stress. Right. Many people lost their jobs. That's an economic stress. So people's eating changed. Let's talk about the COVID-15, the quarantine 15, the quarantine. So we've seen an increase in obesity, a decrease in nutritional choices, but guess whose stock went up? DoorDash. People eating out more, that was crazy. We're eating out more, but not making as much money. So when we think about this mind connected to the body, one thing I like to point out to people is that any negative emotion contributes to stress. Our bodies are chemical. Stress creates 1,400 chemicals. 1,400 chemicals are released in your body. We like to just hear about cortisol, the one for belly fat. We've all seen the commercial. But when your body is stressed and becomes stressed chronically over a period of time, those 1,400 different chemicals are having an impact on every cell in your body. Every cell in your body. Stress affects diabetes. Stress affects hypertension, as we know. Research has even found that stress affects cancer and the progression of cancer. So the pandemic, that mind-body connection, I haven't pulled any research, but it'd be interesting to see what those statistics look like as we come out of this pandemic with how much the stress from the different resources that were limited and the health behaviors changed, how that impacted us overall.
Understood. Dr. Fitzgerald, diversity and inclusion matter in spaces where we need to see our reflection. In the medical field, there's been a lot of mistrust in healthcare. Where do you think that comes from, and what should people be focusing on now?
So there's a significant historical perspective, and many of the things that we as a community know about include things like the story about Henrietta Lacks, who was an African-American woman who was treated for cervical cancer. And with a biopsy, they studied that her cells actually grew, and she's responsible for the first immortal cell line of cancer cells that's still being used to this day to be tested for effects of medication, toxins, things of that nature. And they never told her or her family, and unfortunately she died at the age of 31. But her cells are still being used to this day. Then you have things like the Tuskegee experiment, which actually was only supposed to be a 6-month experience, but it turned into a 40-year ordeal for these unfortunate gentlemen. So there were 600 men, 399 of which actually had syphilis and 200 that did not. They were both treated in a placebo group, essentially, where the men who had syphilis progressed on to some of the complications from syphilis, like tertiary syphilis, neurosyphilis. And even after the discovery of penicillin in 1947, when the study began in 1932, these men still never got the actual treatment for it. And unfortunately, this became public knowledge when the study finally stopped in 1972. Wow. It went to trial in 1974, and a $10 million suit was awarded to the families and surviving patients that included burial benefits as well as medical care. But the entire time of this actual study, none of the men knew that they weren't actually getting treated for syphilis. So unfortunately, there are still survivors that now include the remaining children of the last gentleman affected by it, who is getting some medical coverage and has some burial benefits. But everybody is pretty familiar with these things that have happened, and not to mention just general experimentation in the healthcare field, as well as poorer outcomes for minorities, especially women of childbearing age. And so I think this is all of the reason for it, but I think we need to, again, be represented and try to alleviate the fears that people have and prove that there are some good people in medicine who actually value their lives and their livelihood and want to be there so that we can present with a different sort of understanding. I think that a shared experience helps, and taking the time with these patients and making sure that people understand that you're here to help them is the only way to win the trust back. I don't think that we can erase the decades of experimentation and negative stories, but we can do everything moving forward to proactively show them that we are here and we support them.
Doctor, your statement was very powerful. And with that, I'll just ask you one more follow-up question. You know, when I'm out meeting people in the community, people have raised the concern about the COVID vaccine, and if it's something that we as people of color should trust. What would be your recommendation? What should I say when I come in contact with these people who are asking me, Mr. Banks, should I take this COVID vaccine?
So I would say absolutely yes. I got both of my shots. I got the Pfizer shot. And yes, I was part of the first tier as a healthcare provider, but we are dying at disproportionate amounts from COVID-19. And despite the fact that this seemed like such a rapid turnaround, this technology actually has been in place for years. So I think that it would be beneficial, especially because the complications from COVID can be so grave, especially for us. Usually it's because of secondary comorbidities, so diabetes, things that are rampant in our community. But I think if we don't take the vaccine, just more of us are going to continue to die from COVID unnecessarily.
Doctor, could you define the word comorbidity?
Sure. So this would be other associated conditions that you carry along with you that can complicate an underlying or other disease process. So diabetes, heart disease, things like that. Like Dr. Rox was mentioning earlier, a lot of these things, when they're being treated, can have other alternative side effects like the glaucoma and things like that. So if you're diabetic and you need to take a medication, it can affect you in other ways as well. Heart disease, high cholesterol, things of that nature would all be considered a comorbidity.
All right, so there you have it, ladies and gentlemen. Get the COVID shot. Dr. Fitzgerald says it's okay. I believe Dr. Fitzgerald. Ms. Sumpter, what are the difficulties in making space for treatment facilities for underserved population like those needing HIV treatment and prevention services? And how can lawmakers step in, or how can elected officials step in?
So as I said before, you know, the resources are there. It's just getting our community engaged in utilizing the prevention resources. And I think that lawmakers can start by, again, having these conversations, bringing these things up even after they're elected officials, creating healthy initiatives, creating initiatives, as you had spoke before, Dr. Karima, in regard to bringing up new healthcare professionals who are women of color, people of color. I believe that initiatives like that need to be implemented into even high school education, and making children aware that, you know, sports are okay, being an athlete is okay, but that there are other spaces for us as well, and just creating like that hub of just engaging students and creating opportunities for them, as well as, again, just having these conversations. These conversations are so important. I'm so elated to have them. I'm happy to be on this panel with these women, you know, talking about these things that we talk about. We all do this work every single day. So just that you are interested in even having this conversation, these are the type of things that we need to see happen.
Thank you, Ms. Sumpter. Dr. Rox, or Dr. Hearn, I apologize. Obtaining mental health assistance is difficult in this area. You know, access to these services can take months, if not longer. What are some things people can do to help manage their mental health while they navigate that very troublesome system?
You can call me Dr. Rox. That's what I go by.
All
Dr.
right.
Rox. So you're fine. You're fine. There is a significant shortfall of mental health care professionals in this area, especially in Dauphin County. And oftentimes the issue that residents run into is either having to wait, as you mentioned, long months, or having to travel long distances. And oftentimes Many don't have a car, and there's a limitation to where the transportation services they have available to them will go. I want to make a distinction in answering the question because some assume that mental health means mental illness. And just because you maybe sometimes we've all said we've had a bad mental health day.
Right.
Doesn't mean you have a mental illness. A mental illness is something else that needs to be treated by a practitioner. But our mental health, each and every one of us need to take care of. But to answer the question in terms of what they can be doing while they wait, it depends on if they're being treated for a mental illness or if it's their mental health. So I'll break each one of them down if that's okay. So I'll start with mental health. So mental health, especially during the pandemic, people were more stressed. I think that was the number one thing I seen being reported, people being more stressed. Long-term stress can turn into depression, even if it's temporary. Sometimes there's much like Jill spoke about the stigma with HIV, there's a stigma in mental health. There's a stigma just with the title psychologist, or you refer to psychiatry, there's a stigma. But in terms of your mental health, not mental illness, if you feel like you're spiraling and you're going to harm yourself, if you have thoughts of suicide, plans of suicide, you need to contact crisis, and you can contact crisis intervention. I did write the number down, so those that are watching can take this number, put it on your refrigerator. It's 717-232-7511. 717-232-7511. They're 24 hours a day. They telephone crisis, walk-in crisis. They even have mobile that will come out to you. I'm not certain right now if they've gotten back into the mobile services or not, but you can also walk in. They're at 100 Chestnut Street. So, and this is for anyone, if anyone you know that's having suicidal thoughts of wanting to harm themselves, or homicidal thoughts of wanting to hurt someone else, you also can call 911. Use your social supports. And to keep in mind, not everyone has social support. But if you do have social support, sometimes you need someone to help you lighten the load. If you're working and you have kids at home that are doing schoolwork and the oldest child is helping the younger kids, and you may be a single parent home, maybe you lost your main job, so now you're working two jobs that you necessarily don't like just to make the ends meet, that's a stressor. And although, and Otto, I'm going to speak because there's three fabulous queens on here, Black women, often we are just born, raised, it's just in us to wear this cape. We have to take it on. And I want to say to any other Black women watching, you could take the cape off, sis. Sometimes you got to take the cape off before the cape wears you down and you're no good to anyone else. So use your social supports. If it means I'm not cooking tonight, everybody has to figure it out. I baked the chicken, pick your own sides, you know, if it's the,
you gotta get the snack ramen noodles or something, right?
There you go. It ain't gonna kill you. So right. Use your social supports, whether it's a grandparent, whether it's a sister, auntie, whoever, use your primary care physician. Don't hesitate, because primary care practitioners often are the entry point for those before they seek mental health, when they see mental health therapists, counselors, psychologists, psychiatrists, because that's where they say, yeah, I've been a little sad. A lot of them do screen and ask those kind of questions. Your primary care, if you're in need of an antidepressant, they can write for that. And they often will write for several months, up to maybe 6 months, because of the limited resources that we have in this area. And don't be vague. Advocate for yourself. Don't just say I'm in to see. It's okay to say I'm not okay. On that phone call, I'm not okay. I'm stressed out. I feel like I'm spiraling. When can the doctor get me in? They need to know how serious it is. Contact your health plan. If you have health insurance, whether it's through an employer or whether it's through Department of Public Welfare, call your health insurance provider. They may give you a nurse case manager, or they'll give you the number to the behavioral health support. Those that have employers, there's something called, you probably heard, your EAP. That's the Employee Assistance Program. Go to HR. It's confidential. You get so many sessions for free. This is someone that doesn't know you. A lot of them are telehealth right now, where you can just let it all out to somebody else. And sometimes just venting is enough. Be mindful of your coping mechanisms. Are you drinking more? Did that glass of wine turn into 2 bottles? Are you starting to smoke? Did you pick back up bad habits? What's your waistline feeling like? Are you acting out? Are you more easily agitated? Those are all signs that your mental health, not that you have a mental illness, but that your mental health is not well. But especially if you suffer from a mental illness, such as depression or bipolar, even PTSD, all of these things can be and have been triggered in many by what we're going through with the pandemic, with stressors being so much higher, and also with it affecting medication compliance. And by that, I mean,
not to mention, Dr. Rox, I mean, just being a person of color adds its own level of stress
yes,
in itself.
Yeah.
Absolutely. Ms. Sumpter as well, and of course, back to you, Dr. Rox. Much of the work that you two do in terms of prevention requires a proactive group. How do you bridge the gap between a person's intention and getting them to move towards execution? First with you, Ms. Sumpter.
So we use a technique in HIV treatment called motivational interviewing. And what it is, it's a counseling technique that guides the individual that we're treating to their own conclusion and to their own solution to their problem, rather than us telling them what they should be doing. And the technique is used by us listening and asking guiding questions and open-ended questions. And most times the individual or the patient is able to come up with a plan and a goal or action plans and what they need to do in regard to their as far as their treatment is concerned. And it also allows them to be very interactive with their treatment. They're engaged in their treatment. We're listening to them. We're listening to what their barriers are. We're listening to what their strengths and their weaknesses are. And we're able to support them and make them feel heard and validated. And also, building a relationship with our clients. Like I said, I've been in this HIV field for almost 11 years now. And I have clients that I've known since when I started passing out condoms on 3rd Street. I see these same patients, and just building that relationship. And it's so important to have a presence, people of color, women of color in these spaces, because my clients feel like they can tell me anything. They can tell me, if they're a sex worker or if they have a substance abuse treatment and they don't feel judged. And like I said, we meet them in the middle and we meet them where they're at, and we're able to give them, we're able to help them come up with solutions or a plan and support them in that way. So absolutely just listening, making them feel valid. I hear you, I understand you, and I'm here for you, and I'm here. And, what do you need in this moment? So that has always worked for me in ensuring that individuals are, adhere to their medical treatment as far as HIV is concerned.
Okay, Dr. Rox, how do you bridge the gap between a person's intention and getting them to move towards execution?
In psychology, we also use the motivational interviewing counseling technique. And we use that technique more when someone is in a stage of pre-contemplation or contemplation. And this continuum that we discussed, pre-contemplation, person's in denial, I don't need to make any changes. Contemplation, denial and delay. It's should I, maybe, decisional balance type. Then their preparation. You know what? I want to do this. And then there's action. And then there's the maintenance phase and there's relapse, and we can go back around. But it's getting them from, as you said, this intention behavior gap is what we call it in psychology. I have an intention. I'll use weight because it's easier. I want to lose weight. I have diabetes. It runs in the family. I have hypertension. But it's bridging the gap. What's getting in the way? How we meet them, as Joe said, you meet them where they're at. And you also move at the pace at which they're ready to move. You don't put on the expert hat, which is difficult for many of us in the healthcare field, but you act as we say in coaching, your guide on the side. You're their biggest cheerleader. You give them information with permission. So first you say, do I have your permission to give you this information? So that way you're not putting on the expert hat. And when they see, as Joe mentioned, is from the same context of motivational interviewing, that's how they trust you, because they're a part of their plan. They're a part of what's going to work for them. Because after all, we believe that the individual knows themselves best. We just help them pull out, highlight those strengths, and apply them to bridge that gap.
All right. And your ice is just as cold.
Yeah, my ice is just as cold.
I hear you. Dr. Fitzgerald, the social determinants of health have always been a way to assess how disparities hinder our residents from receiving optimal care. Can you explain the social determinants of health and the disparities at play in our local city?
So these are the conditions that people encounter from birth, life. They also include things like money, power, and access. So all of these things are different determinants that play a part in whether or not a person is able to obtain healthcare. And then some of the other barriers that also affect health include, like we were talking about already, social support. So is there social support at home? If not, then you may not seek something out because of fear or just not knowing. There, food security. I know that that's something that we don't necessarily talk about enough, but are you in a food desert? Do you live in an area where you don't have access to the freshest produce? You don't have access to a grocery store? And then if so, what kind of things are available to you? So you may be surrounded by 4 McDonald's, but no grocery store. And now ultimately you're diabetic and your foot is getting cut off. So that's one of the things that gets put into play. Your financial strain. Are you a single parent? Are you the only person providing for your entire family? How many, other bills and stressors do you have from that standpoint? Your education level. A lot of times we often hear the thing, you don't know what you don't know. And so people may not realize that if they don't have a screening colonoscopy because nobody in their family ever had cancer, that they would still be at risk because of their age. And so without that education, without that sort of ability to know these things, a lot of people don't necessarily seek access because they don't know they need it. Then access in and of itself. Do you have a doctor within a certain mile radius of your home? Are you able to get in? Is the next, a next appointment not for another year? And so now you're waiting. And while you're waiting, you're basically just festering because there's nobody else in the distance in the vicinity that you need to get to. Do you have transportation? And if you don't have transportation, what options do you have? So all of these different factors that you don't necessarily put into the context in isolation of how they affect your overall health can ultimately become a major issue just in terms of looking at them, especially when you have multiple different factors that could be potential setbacks. Even access to gyms and things like that in terms of being able to be physically active. Do you feel safe? So are people going outside, or are you afraid that your neighborhood's not safe? You might get robbed, anything along those lines. And then again, access to, do you have a mental health history? Are you substance abusing? Is there a domestic situation at home? All of these different factors ultimately affect your ability to obtain care and how you view your own wellness.
Amazing. Thank you, doctor. As more people get vaccines, we're going to see people coming outside and wanting to return to their activities. In this city, however, there's a lack of youth programming for the younger kids to return to. I myself, while I'm out in the community, people always say to me, Mr. Banks, there's just not enough things for our children to do. These kids, they're always out here in the streets, they're shooting, they're getting into trouble. What can you do to create activities for our children? And what I do what I've done is I share with them my plan for the Harrisburg School District. And the plan, as John, people see a Johnny and they say, Johnny's just a bad kid. I'm a firm believer that there's no such thing as a bad child. What happened is the child came from an environment that created that type of behavior. So in order to really effectively address Johnny's behavior, we have to look at Johnny holistically and see what's going on in Johnny's household. When you go to Johnny's household, I'm sure all of you would agree that there's going to be some sort of deficit in that household. Either there's going to be an education deficit, there could be an issue with drug and alcohol usage, or there could just be just depression and, of course, the socioeconomic stressors that come with abject poverty. So in order, from my perspective, to address Johnny, we have to address Johnny's family. And what I've done is I've already had meetings with John Ski from HAC, who is in agreement. He signed off, as well as Dauphin County Commissioner George Hartwick. And what they've agreed to do was identify 3 schools and put case managers in those 3 schools. So when Johnny goes to school and he goes to his classroom, his mother, father, and or grandmother can go to one of those offices and seek the MHMR referral services that they're not getting or have access to in the community. So what I'm essentially doing is turning our schools into beacons. Our schools close at 3 o'clock. Essentially for education. I want to expand them beyond the normal hours of operation. So now Johnny has some place to go, and his mother, father, and or grandmother also has a place to go and not only receive the mental health services that you were talking about in referral, but they'll also be able to receive assistance with filling out the FAFSA. And all of you are educated on this call, but I tell you what, that financial aid form is one of the most difficult forms to fill out. And Ski from Hack is going to have people in there, and we'll also be able to get his parents enrolled in not only GED programs, but also training. But now let's talk about Johnny, because we know Johnny has an IEP right now, and Johnny also needs some support structure. So how are we going to provide Johnny the support structures? What we're going to do is take these community groups like Loop Bing, Breaking the Chains, Jones Resources, Bro to Go, all these other organizations who are already providing services in our community, and we're going to bring them into schools to serve as program managers, and they're going to deliver services right there in the schools to our children. But oftentimes, and I think, Mrs. Sumpter, that's an issue I raised with you about funding. How are we going to pay for it? Because historically, everyone says, like, we know what needs to be done, but where's the money coming from? I know how to pay for it. There are 3 streams of revenue that we can use and tap in to pay for these programs, not only address Johnny, but Johnny's family. One, of course, is the CDBG money that we get from the federal government, because that money can be used for the elimination of slum blight, and also can address social issues in our community because it targets impoverished communities. So there's a stream of revenues right there. The school district gets Title I money. That Title I money is finite. It's not infinite. That's the reason why the district, in my view, has a difficult time addressing the needs of all these children, because they only get a little bit amount of money. But if you marry that money with city money, and then there's one more stream of revenue, and that comes from a school choice program called the EITC tax credit program. That particular program is highly supported by corporations throughout the Commonwealth of Pennsylvania. And that program, what happens is that corporations, and this is something you might be interested in as well, Ms. Sumpter, is that program, corporations can contribute up to close to $1 million a year to nonprofit organizations and receive a 90% tax credit against their state liability, in addition to their federal write-off because they're 501c3s. So now we have private industry supporting a Harrisburg School District initiative in addition to the city, and then you marry that with the school district has, and we're going to change the trajectory of not only our children and our families in this community. And you know, I'm excited about it because we've already got people signed on that are willing to put the bodies in there, and we can move forward. So with that being said, Gillian, I'm sorry. What are some challenges in not having youth programming with the population that you serve? And do you believe that youth activities can help?
Absolutely. That's so important. Our schools don't have any prevention programs or programming for children to learn a trade. I know growing up, we had the William Penn School right here. Where we could learn a trade. We could learn how to run a business. We could learn home economics, how to fix a car. We don't have these things. We're not equipping our children with a trade or with skill sets that will teach them how to navigate life. Okay, so if we talk about kids, we want to talk about crime and this and that. What are we doing as a community, or what are our politician leaders doing in order to create initiatives that, as you already spoke on, you have the formula of what needs to be done, and absolutely combining all those funding sources, of course, but also making sure that we are documenting the outcomes of them so that we can continue year to year to get this funding sources to come in. And that's how we sustain programming for schools. Again, athletics are wonderful and great, but not every child is an athlete. Some children are intellects. Some children are musicians. Some children are artistic. We need to tap into all of these different things. These children have nothing to do. That's the most important. That's near and dear to my heart. And I think that number one. That could be the number one thing to turn in this city around, and the trajectory of what it has been is to create initiatives for our children. Not just having something to do. targeted initiatives that will give our children skill sets to survive.
That's right. And we also got to target the parents and help them as well, right?
Absolutely. Absolutely. And like you said, it's an umbrella. It starts with the family. And of course, like you said, that everything you stated is important. But again, like just creating something that these children can learn how to navigate. If you only give children option to play basketball or football and they don't know how to do that, what are they going to do? They're going to go outside and figure out the best way that they know, the best thing that they know how to do. So, I mean, that has to change. Our school systems have to change.
And we got to be there to help and support them as well. And that's what we're going to do. We're going to find the resources to ensure that our Harrisburg School District not only becomes better, but it becomes one of the best in this Commonwealth. So, Dr. Rox, what are something you want individuals to know about keeping their minds, bodies, and spirits healthy?
We're winding down the show, so I'll keep it short and sweet. You only get one body. You get one place to live. I don't know who said the quote. It's not mine, but it makes sense. Let it resonate. You get one place to live, one body. That's all. What are you doing with it? What are you doing with it? Don't blame genetics, because it may not be grandma's hypertension that was passed down, but it might be what grandma put in those pot of greens that created it. You know, sometimes it's the behaviors. Yes. So we talk a lot online about generational wealth. There's also generational health, because health is wealth. So choose something and start now. Don't wait. Something small. You can start drinking more water today. Choose something small. Stop looking for excuses. Find someone to hold you accountable. But the one thing is, stop and just do an evaluation. I have this one body to live in. What about it do I need to change so it doesn't continue to fall apart as I age, so I can be there for my children, for my grandchildren, and not only age better, but have a quality of life. It's one thing to grow old, but when you grow old, are you going to be the 80-year-old that has the limp and you got an oxygen tank on your side? Or you want to be the active 80-year-old living the best life you can live at 80? So think about that. And this is especially for those in my age group in the 40s, even the younger ones. But you hit your 40s, things start falling apart. You got to pull it together before it's too late. Because if you don't,
watch it now. I'm 50, so
same thing.
So it must already fell. So it must already fell
on the census.
Dr. Fitzgerald, many have a poor outlook on local healthcare facilities. How important is representation in those leadership positions in addressing our city's outlook on medical facilities altogether, but specifically our city's healthcare systems?
I think one of the issues is that the quality of the places is questionable in certain areas where people have access. And the leadership is not necessarily cognizant of that if they're not understanding why people are so apprehensive about going there. So I think when you have certain people who have a sort of shared experience, or at least a better understanding, who are more invested in our communities, if we are in those positions and work in those particular places, then I think it would make it a lot easier for us to show that there's a different side of healthcare and to provide a better quality of care. I think we need to prove to people that despite the location, that the providers actually do care and will provide the quality that they deserve. I think in the past, one of the things that has happened is that people basically got told, okay, here, take this medication or do this without understanding exactly why, without a provider going into further detail in terms of looking into the social determinants of their health and why they haven't sought certain care or why they were apprehensive or concerned about following what the advice was given. So if we have more people in leadership who have more of a concern for this sort of time to be spent and the compassion that goes along with this, I think that it would make it a lot easier for us to utilize those spaces and get quality providers in those spaces.
All right. Well, unfortunately, we are out of time. I want to thank Dr. Rox, Ms. Sumpter, and of course, Dr. Karima Fitzgerald for your time, expertise, and dedication to not only serving the residents of Harrisburg, but our entire Dauphin County and Commonwealth of Pennsylvania. Thank you so much, ladies. And I appreciate you wearing your super capes all day, every day, being there as a support structure for all of us in the city of Harrisburg. So with that being said, again, I truly, humbly thank you for your time. And ladies and gentlemen, we'll have our next town hall or Otto's Hour coming up pretty soon. So you can join me for a special edition where we'll be meeting on education and we'll focus on answering some of your important questions. Ladies and gentlemen, thanks again for joining us for Otto's Hour.
Thank you.